Hey everybody, it is April the 20th, and I just wanted to do a quick vlog while I have the apartment to myself, where I would say it's quiet, but it's not, because I just got home and Riley's excited to see me. Right, Riley? You can hear him. Anyways, okay, just shh for a few minutes. Um, So I just wanted to do a quick vlog to let you know how the speech therapy assessment went. I had that last Wednesday, like right after Easter. And, excuse me. Riley! Shh. That's not going to work. So it went really well. The speech therapist was really nice, and the cool part is that the original speech therapist slash ENT that vocal coach had sent me to, he was going to charge $600 just to do this video scope of my vocal cords, plus like I think it was like almost 100 per session or something like that. And you know, even though we have coverage like for speech therapy, like just the test alone was gonna like blow all the coverage that we have for it. Excuse me. I have a bit of a cold, or allergies or something. And anyways, with that, I thought I would just go back to the first ENT I saw, get the referral for speech therapy at a hospital, which I went to St. Mike's Hospital in Toronto. And it was so much better because the assessment was $90, but that's going to be covered, like 80% of it will be covered. And with that, they did the video scope at no cost. Like, I guess OHIP covers the test because it's in, like, the hospital system, right? So that was a lot better. So basically, when I first saw her, she did the video scope. That was kind of weird because it didn't hurt or anything, and it wasn't as bad as when they would put the scope down the nose. However, I have a serious gag reflex problem, and so she would get it in totally fine, but she had to like hold my tongue out so that the tongue wouldn't like, automatically move around, reflex. And so she's holding my tongue, I had to have my mouth open as wide as I could so she could get it in. And then I had to say he, and it's really hard to say he when your mouth is open and your tongue is hanging out. It comes out more like ah. So, but she told me to keep thinking he, and so every time I would try to do the he, my throat would end up like touching. My throat and the back of my tongue would end up touching the scope, and then I would end up gagging. So after a couple tries of that with no success, they sprayed something in my throat to numb it, in hopes that it would stop the gag reflex. And it helped a little bit, but not a lot. So they didn't get the best images that they could, but it was enough for her to see that there's nothing structurally wrong with my vocal cords. So, like, there is no nodules. She did see, like, a little white part that was a little bit of a bump, but she said it wasn't concerning, and she said it may have actually been something that used to be there but is almost gone. So she's not worried about that. Like, there's nothing structurally wrong with my vocal cords, so that's good. So then I went into another room, And she did some more tests with recording my voice and looking at different numbers on different things of my vocal cords that I have no clue what any of that meant. And she also had me like read something and record me reading something and played it back and did all these things with numbers and stuff like that. And then she went through the questionnaire that they sent me in the mail that I had to fill out and bring with me, which went over all kinds of things, like asking me if I have certain symptoms, hoarseness, cracking of my voice, all these different things. And just asking, why I want to improve my voice and blah, blah, blah. And it also was asking, like about my water intake and, how often I use my voice, what kind of job do I have, all kinds of things. Whether I sing professionally, blah, blah, blah. Just a million different questions. And basically, once all was said and done and we finished, she came to the conclusion that the problem with my voice is connected to a few different things. And the things that she found it connected to, it's kind of funny because I kind of, in my mind, figured that this was the problem, and so I was right. So anyways, basically, it's a combination of a few things. It's a combination of overusing my voice at work, and probably with singing over the years. It's also the fact that, as I found out from the respirologist, that my breathing muscles are weak. So my diaphragm is weak, and my breathing muscles in general are weak. Therefore, if I'm not breathing right, my vocal cords aren't working right, and strain is put on the vocal cords to compensate for the fact that I'm not breathing properly. Okay, Riley. So that's another factor. The other factor is stress. With all the different health problems I've been going through, just my body in general is tense, from everything it's been going through and everything that I'm processing since being diagnosed and whatever. And it's all, it's causing tension in my vocal cords, in my neck, in my throat. So that's another factor. And another factor, she said, could also be a little bit about my water intake. Like, she said that from what she could see, I don't drink enough water. So she's asked me to have water with me at all times at work now, and just takes, even if it's just a few sips here and there throughout the day. So I've been doing that. Yeah, I think that's pretty much it. It's just like tension, stress, weak breathing muscles, just everything piling up. And the good part with that is that she can work with that, and she can maybe not make it 100% better, but at least give me some tools to maybe help strengthen my breathing muscles and help take some tension off of the vocal cords. So to start out with, before I left, she taught me how to do various types of massages on my vocal cords. And I felt totally weird doing them at first, especially because I still hate all this in here. And she made me give her my phone and videotape me doing the massages so that I could remember them and continue to do them at home. And, she wants me to do it, several times a day whenever, I've been doing it when I'm watching TV, or sometimes when the kids are napping at work and I don't have a whole lot of work to do. Sometimes when they're sleeping, I'll, start doing the massages. So she wants me to just try to rest my voice as much as I can, and keep doing the massages daily until I see her again in 3 weeks. Now, I unfortunately could not get the appointment that I was hoping for in 3 weeks. So it's actually going to end up being 4 weeks, I think, until I see her again. I'll be seeing her May 14th. Yeah, so that's it. That's the start of my speech therapy. And she thinks after 3 sessions I should be good to go. So I'll just have 3 more sessions to see her, and that'll be it for my speech therapy. And hopefully by then my voice won't be cracking as much and my voice won't be hoarse as much, and I'll be able to sing a little bit better again and maybe sing a little bit longer than I can currently. Oh, and also I remembered another thing. Excuse me. And that just reminded me of the other factor that's playing in this is the fact that I have had so many colds on and off in the past few years. I mean, I'm getting so many colds where I get a lot of the sinus stuff and a lot of like the postnasal drip, and it's making me clear my throat a lot when I get the phlegm. And she said, when you clear your throat, your vocal cords are banging together. So so that's not good. So I don't know what we're going to do in terms of that. I guess there's not much I can do on that, but at least if she can help me, breathe better and, help me use my vocal cords more properly, I'm sure that will help in some way. So if I get brave enough, I will post the video of the massaging of my vocal cords. I hate the way I look in the video, so I haven't decided if I'm brave enough to post it yet. But we'll see. So anyways, tomorrow is the annual general meeting, the lupus one I was telling you guys about. And unfortunately, Alex now has to probably work all day. So I'm kind of disappointed about that because I was wanting him to come with me and he already paid for his ticket. But he said he has like a lot of work piled up and he has a deadline that he has to make. So he probably will be going to work tomorrow. So my mother is coming with me as well. So I guess maybe I'll try to do some video vlogs or vlogs or whatever while I'm there, and it's going to be a long day, so I'm going to try to get to bed early tonight, maybe take a sleeping pill, because we're going to be there from like 8:30 a.m. until like probably 7:30 p.m. There's going to be like 3 guest speaker doctors, and there's going to be a lunch, and there's going to be like a dinner, a volunteer appreciation dinner, and there's going to be a lupus patient there sharing her story, and just so much stuff. So I've heard that it's excellent, from people that have gone in previous years, and a lot of people from my support group are going to be there. So it should be interesting, and I'll try to maybe make some videos while I'm there. Or if not, just at least I'll let you know how it goes. See you guys in the next video. Bye.